Nnadi with us. Hi, Dr. Nnadi. How are you?
Hi Maria, how you doing?
Good. It is so glad to have you back.
It's great to be back.
Yes. And, we always have new followers, and I want you to introduce yourself so everybody knows who you are and what do you do for the Charlotte community.
Okay, thank you, Miss Maria. So I'm Dr. Stella Nnadi. I'm a dentist here in the university area in Charlotte. I'm also trained in dental sleep medicine, and dental sleep medicine in summary just means we provide an oral or a dental solution to a medical condition. We recently opened a brand new facility called Charlotte Sleep Solution here in the university area. You can always drop in to have a complimentary sleep screening or consultation.
Yeah, so that's what was going to be my next question. We're so happy to have you in the community, and I wanted to see what do you guys offer at Charlotte Sleep Community? Charlotte Sleep for Kids. Sorry.
Yes. Yeah, Charlotte Sleep Solutions. So we do treat both kids and adults, but since this is a kids forum, we just concentrate on the kids.
Okay.
So briefly, we treat airway and sleep disorders, such as snoring, obstructive sleep apnea. And like I said, we treat both children and adults. So treatment is done in a natural, holistic, non-invasive, non-surgical way. We have devices that you wear in your mouth that help remodel the airway or help regrow the airway to its right size. So breathing at night is optimized. And we also treat snoring with pain-free lasers. So that's the summary.
That is awesome. For us parents, we're always worried about, the kids needs to go to sleep, napping, all that involves sleeping, because we know if they sleep, they learn better, they perform better through the day. So we just want to ask this common question that everybody, wonders. How many hours of sleep should kids be getting?
Okay, that's a very good question. So according to the American Academy of Sleep Medicine, school-age children from 6 to 12 should be sleeping regularly 9 to 12 hours. That's 6 to 12. So for example, if a child needs to be up for school at 7 o'clock in the morning, they should be at bed 8, 9 latest.
Okay, yeah.
Getting that at least 9 to 12 hours. Now for the teenagers, they're a little older, 13 to 17, 18 years old, they should be getting at least 8 to 10 hours.
Okay.
Our children are not getting enough sleep at night.
I tell you, there's so much going on after school. School ends so late, and then they have to go to all this, after school activities, sports practice. They keep moving later and later. So, it's important for us to know, parents, how many hours should they be getting?
Yes, we know that, insufficient sleep results in insufficient restorative sleep, but that's when the body repairs itself. That's when the body grows. And, when the child is not sleeping long enough, it results in various negative outcomes.
Yeah.
Yeah, we can go on and on.
Maybe. Yeah, we can go on and on, and we will have more of this informational videos coming up.
Yes.
But I have a quick question before we finish our interview, because this is supposed to be only to introduce yourself, but I have a really question. What common signs if we should see what should we be looking for if kids have an unhealthy airway or not getting enough restful sleep?
Okay, so there are several, but for purpose of time, I'll just list the most common ones. First of all, if your child is habitually snoring at night, this is not normal, not even for adults, by the way. It shows there's something going on in the airway. Either there's an obstruction or the airway is not fully developed. Most common reasons might be swollen adenoids or tonsils in kids. Okay. Or the tongue might be falling back. So the child is snoring. That's the first sign. And when I say snoring, habitually snoring. If the child has a cold that night, maybe stuffed nose, they could snore, but if the child just snores habitually, that's a concern. If your child is mouth breathing, that means his mouth is perpetually open. And you can see the child might be sitting down and the mouth is open. That's a concern. There's something going on with the breathing. Or if your child is still bedwetting after the age of 7. There's a relationship between sleep and bedwetting. After the age of 7, that's a concern. If your child has crowded teeth, there's not enough room in the mouth for the teeth. That means the upper and lower jaw is not developed like it's supposed to be. So there's not enough room for the teeth. So the teeth are crowded. That's a concern. If the child has allergies, high susceptibility to allergies. So those are the few things to look for.
They're very important for us, really, you pointed out things that parents can just, take a look at tonight or, maybe in the next week and see what's going on. Well, thank you so much for your time today. We're going to do it short interview so that way everybody can get time to watch it. I know time is precious right now, but
yes,
we really appreciate your time and we're looking for our next interview.
Thank you very much, Miss Maria. Bye-bye. Thank you all.
Thank you.